High blood pressure. It's been known for some time that high blood pressure puts you at greater risk of heart attack and stroke. It's also been clear that exercise can help lower blood pressure in many people. But some medical professionals have had questions about whether workouts are really good for seniors. Researchers have been uncertain whether exercise significantly reduces seniors' blood pressure, and some have worried that workouts could actually cause the heart attacks and strokes they're intended to prevent. Well, a recent study offers some new reasons to get back to your exercise. Let's see what it's found.
Olive Smith lived with the silent killer.
You don't feel it, you don't know it, but it's there.
She had high blood pressure, also known as hypertension.
It confers a very high risk of having either a heart attack or stroke, and it's a silent killer because there's usually no symptoms associated with it. People can have it, but they don't know it, and the only way to really find out if you have it is to get it measured.
I thought, okay, it's a natural part of aging, and I was leading a fairly sedentary life, and I wasn't paying a whole lot of attention to what went into my mouth, but I was conscious of the fact that as you age, you tend to have hypertension.
If you had a ingrown toenail, it would hurt you, and you'd run to the doctor, the podiatrist, and get it cut out, and you'll feel better. But with high blood pressure, you don't feel it. So the first challenge is to get people to understand that this is a problem, even if it's something they don't have any symptoms.
More than half of all Americans over 60 have high blood pressure. Blood pressure is the measure of the force of blood through the arteries. It's expressed as a ratio. A reading of 120/80 or lower is considered normal, although low blood pressure can cause problems as well.
Good. 125/80.
According to the National Institutes of Health, there are several steps that many people can take to prevent or lower high blood pressure. They include losing weight, eating healthy foods, limiting alcohol consumption, and exercising. But Dr. Carrie Stewart of Johns Hopkins University Medical Center wondered whether exercise is really an effective way of controlling blood pressure among seniors.
The reason why we think that's an important question is because the cause of blood pressure is different in seniors than it is in younger people. Younger people tend to have high blood pressure because they kind of have a hyperactive cardiovascular system, where seniors are more likely to have high blood pressure because their arteries start to get stiff. And when the arteries get stiff, greater force is needed to move the blood. So it's not entirely clear if exercise would be as effective in seniors as it would be in younger people.
To find out, Dr. Stewart and his team recruited Olive Smith, Dorothy Tudor, and 102 other volunteers with mild hypertension to participate in a research program. Known as the SHAPE study, it was designed in part to determine whether exercise is helpful to seniors with high blood pressure, or actually harmful.
The question is, does these repeated bouts of exercise, which brings the blood pressure up to 200 for 20, 30, 40 minutes at a time as people working out with weights and working out on the treadmill, would that have any harmful effects?
For Olive and Dorothy, the study took commitment. They were required to exercise at Johns Hopkins Medical Center an hour a day, 3 days a week for 6 months. But Olive welcomed the experience.
The SHAPE study was like the magic program as far as I was concerned, because it didn't involve pills and it didn't involve anything other than exercise and some diet control.
Their blood pressure was constantly monitored, and the data were compiled. The results, published in 2005 and 2006, were conclusive.
We found that exercise did lower the blood pressure at rest, although not quite as much as what you would have expected in younger people. We found that the exercise did not seem to reverse some of this stiffening in the arteries that we found. But we found that there were no adverse effects of exercise on any of the measures of cardiac function or size, so that there were no harmful effects at all in exercise among older people who had some high blood pressure to begin with. So we think it's certainly safe for seniors to exercise.
In helping Dr. Stewart reach his findings, Olive helped herself as well. She lost 20 pounds while participating in the SHAPE study. She also lowered her blood pressure to a normal range, changed her eating habits, and became a health and fitness enthusiast.
The strange thing is, the more you exercise, the more energy you seem to have. You don't get tired, you've got more energy, which I just think is really great. And I have a history of people in my family with a great deal of longevity, and I want to get to the end of that road feeling good and not being on medications and stuff like that. So I'm figuring another 20 years maybe, and I plan to stay healthy for that whole time.
The SHAPE study helped Dorothy Tudor lower her blood pressure too, but she was unable to reduce it to a normal range. She is on medication to keep her blood pressure in check. Still, she is committed to following the exercise routine she learned while participating in the study.
It kept me in touch with the fact that you have to use what you have or lose what you have. You get to a point where if you don't walk and you don't exercise and you don't take care of that portion of life, then you're not going to be able to walk, and you're not going to be able to clean and make the beds and go to work. It's as simple as that. You have to use it or you're going to lose it, and especially as you age.
The bottom line? According to the SHAPE study, it doesn't matter how old you are. You can lower your blood pressure and improve the quality of your senior years with exercise and a healthy lifestyle.
Joining me to discuss the dangers of high blood pressure and the value of exercise for seniors is Dr. Denise Simons-Morton. Dr. Simons-Morton is the Director of the Clinical Applications and Preventative Program at the National Heart, Lung, and Blood Institute, part of the National Institutes of Health. She holds a medical degree from the University of Maryland School of Medicine, a master's in public health from the Johns Hopkins School of Hygiene and Public Health, and a PhD in epidemiology from the University of Texas School of Public Health. Thank you so much for visiting us at the Daily Apple.
Thank you, Alexis. Thank you for having me.
Why is high blood pressure such a widespread problem?
Well, high blood pressure, first, let me say 65 million Americans have high blood pressure, and as you saw in the segment, half of adults over the age 60 have high blood pressure, which we call in medical terms hypertension. Hypertension is really the same thing.
Is it, are people, I'm sorry, go ahead.
No, I was just going to say the reason why it's important is not because of the hypertension itself, but because it can lead to kidney disease, it can lead to stroke, and it can lead to heart disease, including heart attacks and heart failure.
Which are all huge issues for mature adults.
That's right. And heart disease is the leading cause of death in the United States.
Now, is high blood pressure worse in the United States than it is in other areas of the world?
In some countries where there is lower sodium or salt intake in the diet, high blood pressure isn't as much of a problem. It's really remarkable if you look nationally, internationally. Countries where there's higher sodium or salt intake in the diet have higher rates of blood pressure. And we know from those kinds of studies, and also studies, intervention studies, where they've randomly assigned people to eating lower sodium versus higher sodium, that in fact eating lower sodium can reduce your blood pressure. So dietary sodium, in addition to exercise, is a very important factor.
Now, I got the impression, though, from this segment that although exercise for everyone is always good, it's not necessarily that helpful for high blood pressure. Is that the case, or did...
Well, the issue is there have been very few studies specifically in the elderly for high blood pressure, but we have loads of studies in adults that are not necessarily elderly that show that exercise does reduce blood pressure. Aerobic exercise, like brisk walking, it doesn't have to be very vigorous. It can be walking briskly.
How much, though?
So recommendations for health for exercise are to be moderately active, moderate intensity, like brisk walking, for 30 minutes, 5 or more days a week. And that does improve your health. It lowers your blood pressure, it improves your blood cholesterol, it can enable you to maintain a healthy weight or lose weight in conjunction with diet.
That's great. Okay, hold on to that thought. We're going to be right back in a second. We need to take another break, but stay with us. We'll be back in a moment to continue our conversation about high blood pressure and exercise with Dr. Denise Simons-Morton.
True or false? The symptoms of high blood pressure are easy to recognize. True or false? The symptoms of high blood pressure are easy to recognize. Answer: false. The only way to tell if you have high blood pressure is to have it checked.
We're back to continue our discussion about high blood pressure and exercise with Dr. Denise Morton of the National Heart, Lung, and Blood Institute. I want to talk a little bit about blood pressure itself. What is high blood pressure?
So when your heart beats, it contracts and then it relaxes. And when it contracts, there's a certain pressure in the arteries throughout your body. And when it relaxes, there's another pressure. So when you talk about high blood pressure, you're talking about two numbers. The top number is when your heart contracts, and that's called systolic blood pressure. And the bottom number is when your heart relaxes. That's the pressure in your arteries when your heart relaxes, and that's called diastolic blood pressure.
And what should those numbers be if it's normal?
So 140 over 90 or above is considered hypertension, which is high blood pressure. And then 120 over 80 and below is considered ideal or normal. Between those two, there's a condition called pre-hypertension, between 120 and 140 and between 80 and 90. And we know that if you have pre-hypertension, you're more likely to develop hypertension later.
And so is it the same for seniors, regardless of your age? Those are the numbers that you're looking for?
Yes. We used to believe that it was a natural part of aging for your blood pressure to go up when I was in medical school 25 years ago.
You're dating yourself.
Not. Yeah, but it's really not. I mean, we know now that the increase in blood pressure with aging is not good for you, and then in fact if you lower the blood pressure by drugs or diet or lifestyle or exercise in whatever way, that you will reduce the chances of having stroke or kidney disease or heart disease.
I know they call it the silent killer. Are there no symptoms whatsoever?
There are no symptoms. People say they can tell when their blood pressure is up, but it's really variable, and most people can't tell, and that's why you need to get your blood pressure checked, and you need to get it checked regularly.
What is regularly?
Well, annually is at least good for older people. Annually. For younger people, less than annually is probably okay.
So is it, how would I even know? I mean, clearly you have to get it checked annually, but is it genetic at all to have high blood pressure?
There's a genetic predisposition, so people with a family history of hypertension or cardiac disease may have a more likelihood to have high blood pressure. So also, I'm sorry.
Go ahead.
Can I just say, you need to get it checked several times, because just your blood pressure can fluctuate.
Especially when you go to see a doctor. Yeah. Mine always goes up.
When you're on TV.
Yeah. You're doing fine. Let me check. Wait, no, you're good.
And so several readings above 140 over 90 are needed before you're diagnosed as hypertension. So if there's an elevated reading, generally the doctor would have you come back and check it again.
So if you're diagnosed with hypertension, we talked about exercise. Obviously, exercise is always important in every lifestyle. What about diet? What do you do with your diet to lower it?
We did a very interesting study at the National Heart, Lung, and Blood Institute called DASH, Dietary Approaches to Stop Hypertension, where people were fed food so that we can actually test. They were given all their foods. We can actually test, if you ate this diet, what would it do to your blood pressure? And lo and behold, a diet which we then later called the DASH diet dramatically reduced blood pressure as much as medication in the people who had what we call stage 1 hypertension. Can I tell you what the diet was like?
Absolutely, especially if it makes you lose weight.
Well, weight is another issue, but this worked even without changing your weight. We held the weight constant of the patients in the study. So every day you would eat 9 to 12 servings of fruits and vegetables.
Knew you were going to say ice cream. Fruits and vegetables? All right, 9 to 12 servings of fruits.
3 servings of dairy, which should be low fat.
Okay.
And an overall diet that's low in saturated fat and high in complex carbohydrates with fiber, like whole grains.
Okay.
And this diet reduced blood pressure within 2 weeks of people eating it, as much as if we gave them medication. It was remarkable.
So let's go over it one more time. So how many servings of fruits and vegetables?
9 to 12. The reason why there's a range is because people who need more calories, like very active men, may need the 12 servings. And people who need fewer calories, like a frail older woman who's not very active, might need fewer servings.
Okay, low in saturated fat.
Low in saturated fat. 3 servings of dairy, which is low fat.
Okay.
And then it also contained a lot of whole grains with fiber.
Okay. Now, what if I have been diagnosed with hypertension? What kind of drugs am I going to be going on, or what are the treatments besides?
There's the lifestyle, as we said. There's the DASH diet, which I just mentioned, lower sodium diet, which I mentioned earlier, I think, exercise, losing weight. Those are all the lifestyle things that we know work to reduce blood pressure. And then there's drugs. There are multiple different kinds of drugs. There's drugs called beta blockers, drugs called diuretics, ACE inhibitors, calcium channel blockers. They all help to lower blood pressure. And we did another study at NHLBI that compared 4 different classes of drugs. And it turned out that the less expensive, older drugs called diuretics were just as effective as the newer, fancier, more expensive drugs in lowering blood pressure and preventing heart disease and stroke.
Now, I heard through the grapevine, though, that wine and chocolate are good for high blood pressure, too. Is that a folklore, or is that still the case?
Actually, there's evidence on that. The other stuff we've talked about has been proven in studies called randomized controlled trials, where you actually have people change. Now, I don't know of any randomized controlled trials where people have been fed wine and chocolate.
Well,
so
I can tell you before we close, it lowers my blood pressure, so we're good to go. Thanks for being here. That was great information.
Thank you
Appreciate
very
your
much.
time.